Welcome everybody, with you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology and gastroenterology. Our topic today about ulcerative colitis. Ulcerative colitis is an inflammatory bowel disease that causes inflammation and ulcers in your digestive tract. Ulcerative colitis affects the innermost lining of your large intestine, also called the colon and rectum. In most people, symptoms usually develop over time rather than suddenly. Ulcerative colitis can be draining and can sometimes lead to life-threatening complications. While it has no known cure, there are several new treatments that can greatly reduce signs and symptoms of the disease and bring about long-term remission. So ulcerative colitis symptoms can vary depending on the severity of inflammation and where it occurs. Signs and symptoms may include diarrhea, often with blood or pus, rectal bleeding, also passing small amount of blood with stool, abdominal pain and cramping, rectal pain, urgency to defecate, inability to defecate despite urgency, fatigue, fever. In children, failure to grow. Most people with ulcerative colitis have mild to moderate symptoms. The course of ulcerative colitis may vary, with some people having a long period when it goes away. This is called remission. So as regards the types, healthcare providers often classify ulcerative colitis according to its location. Symptoms of each type often overlap. Types of ulcerative colitis include ulcerative colitis, ulcerative proctitis. This inflammation is confined to the area closest to the anus, also called the rectum. Rectal bleeding may be the only sign of the disease. Proctosigmoiditis. Inflammation involves the rectum and the sigmoid colon, the lower end of the colon. Symptoms include bloody diarrhea, abdominal cramps and pain, and inability to move the bowels despite the urge to do so. This is called tenesmus. Left side colitis. The inflammation extends from the rectum up through the sigmoid and descending portions of the colon. Symptoms include bloody diarrhea, abdominal cramping, and pain on the left side, and urgency to defecate. Pancolitis. This type often affects the entire colon and causes bouts of bloody diarrhea that may be severe. Abdominal cramps and pain, fatigue, and significant weight loss. Blood in your stool. Ongoing diarrhea that does not respond to non-prescription medications. Diarrhea that awakens you from sleep. An unexplained fever lasting more than a day or two. Also, the ulcerative colitis usually is not fatal. It is a serious disease. In some cases, ulcerative colitis may cause life-threatening complications. As regards the causes, the exact cause of ulcerative colitis remains unknown. Previously, diet and stress were suspected. However, researchers now know that these factors may aggravate but it do not cause ulcerative colitis. One possible cause is an immune system malfunction. When your immune system tries to fight off an invading virus or bacterium, an irregular immune response causes the immune system to attack the cells in the digestive tract. Hereditary also seem to play a role in that. Ulcerative colitis is more common in people who have family members with the disease. However, most people with ulcerative colitis do not have this family history. Ulcerative colitis affect about the same number of women and men. Risk factor may include age. Ulcerative colitis usually begins before the age of 30, but it can occur at any age. Some people may not develop the disease until after age 60. So, as regard race or ethnicity, although white people have the highest risk of the disease, it can occur in any race. If you are of Ashkenazi Jewish descent, your risk is even higher. Family history, you are at higher risk if you have a close relative, such as parent, sibling, or child with the disease. As regards the possible complication of ulcerative colitis include severe bleeding, severe dehydration, a rapidly swelling colon, also called toxic megacolon, a hole in the colon, also called perforated colon, increased risk of blood clots in veins and arteries, inflammation of the skin, joints, and eyes, and can increase the risk of colon cancer, bone loss, also called osteoporosis. Ulcerative colitis is a chronic inflammatory bowel disease that primarily affects the colon and rectum. It causes inflammation and ulcer in the lining of the digestive tract. Here are some key points about ulcerative colitis. The common is diarrhea, abdominal pain, rectal bleeding, urgency, fatigue, weight loss, so also nausea, dehydration, fever, joint pain, skin problems, eyes problems. So, as regards the signs, increased fever, severe abdominal swelling, or persistent vomiting. This means that the complication started to appear. Sometimes flare up and remissions. So symptoms may worsen during a flare up, and the frequency and the severity can vary. Remission periods where the symptoms significantly decrease or disappear. If you experience any of these symptoms, especially persistent diarrhea or blood in your stool, it is important to consult healthcare professional for evaluation and management. So, the patient complains of mainly bleeding diarrhea, and the main diagnostic tool is colonoscopy, which can diagnose the condition. Thank you very much.